Gunaratnam for Minji Digestive Health. I also have the pleasure of serving as president of the Digestive Health Physician Association. Welcome to Private Practice Perspectives. Joining me today is my longtime friend, Dr. Larry Kim from South Denver GI, who is also president of the AGA. I'm excited about this discussion about how GI societies can best support fellows and early career physicians as they navigate their careers. Larry, welcome to Private Practice Perspectives.
Naresh, thank you so much for having me, and I really am looking forward to this opportunity.
So you and I go back over 30 years, and we started as the fellow reps for AGA back in the day when they had Model T cars and stone axes and so forth.
We're not quite that old.
That's right. And you've always had a passion for building the next generation of GI leaders or inspiring them. As we face a growing shortage of gastroenterologists in the United States, what can we do to encourage fellows to become GI doctors?
This issue of workforce in GI has really been targeted as an area for collaboration that all of the societies are going to continue to work diligently on. So I think that this question of how do we build the next generation of leaders in our specialty really is critical, because one of the things I have definitely encountered as I've met fellows is that our young gastroenterologists really want to be engaged. They're just like we were, 35 years ago. They're energetic. They're not afraid to think outside the box, but they need opportunities. So at AGA, that's definitely something that we have taken very seriously. Outside of the trainee and young GI committee itself, we have dedicated roles on all of our committees for younger generation gastroenterologists. We're rethinking how we communicate with young people. And we've actually, unlike what existed when we were just getting started, there are actual pathways to leadership development. So I'd encourage anybody who's out there watching this to look into the opportunities that AGA provides. Our Future Leaders program, our Forward program, the women's leadership tracks. There's all of these different opportunities to get involved. But do get involved. That's the way that you move up, you advance your career, you stay engaged. It brings incredible personal satisfaction. And honestly, we need this as a profession. We need the next generation to step up.
Yeah, just to tie in something, you and I were very fortunate to have great mentors within AGA, and I think they guided our careers. And I think that's the best part of AGA and frankly DHPA. And we've had some very substantive discussions about collaborating further, which I'm really excited about, DHPA and AGA, and especially with leadership development. So I'm really looking forward to that because there are great leaders both in private practice and in academics, and the leadership principles are very similar. So I think I would encourage fellows to really tap into those resources. As a physician in private practice, how can we best promote benefits of independent GI to fellows?
I really have to say that decision to pursue a career in independent practice in GI really has been one of the best professional decisions I've made. I think you and I, Naresh, both know that mid-size to the larger groups in the community now really have evolved into sophisticated organizations. They are efficient. They are nimble and innovative. As a gastroenterologist working in private practice these days, you can pick your niche if you want to do research, if you want to teach, if you want to develop leadership skills. Those avenues are all open to you. And in addition to that, as a partner and an owner of your business, you also have far greater autonomy than anyone working in a more institutional environment. I really think that the problem is fellows who are ensconced in institutions, in academic environments, just don't know what's out there. And I think the way that we change that is really to increase the visibility of clinical practice leaders around the country. I mean, what you and I have long tried to do. And a big pathway to do that is to get involved through organizations like DHPA, like AGA.
Yeah, I would agree. And I think you have to sort of find your happy place. And I think if you're a clinician who really enjoys taking care of patients, one of the things I love about a small community-based practice is that you're taking care of people in your community. Lastly, we ask our guests to provide some advice to young people who are considering careers in healthcare. What would you tell a young person who's thinking about following your career path?
Yeah, I guess this is a little idealistic, touchy-feely, if you will. But I would say don't lose touch with your love for patients. You know, all of us went into medicine because we wanted to help people so much because that's become a total cliche, right? When you're interviewing medical school applicants, you know, don't ever say as an applicant that I want to help people, right? Because everybody else is saying the same thing. But it's amazing how incredibly easy it is to lose that impetus as we try to survive, you know, our education and our training process. And I think even especially in GI, right? Because we have so much of that procedure focus. But just as you alluded to, Naresh, I got to say that after 27 years of doing this, my deepest satisfaction doesn't come from that perfect colonoscopy I just did, but it really comes from that long-term relationship that I've been able to develop with my patients, you know, getting to know them, getting to know their families, their friends. And I really think that if we keep the patient at the center of our focus, we will always make the right decisions, not just as individual physicians, but as a specialty.
Yeah, I would 100% agree. I think one of the benefits of GI is that we get to live in this hybrid world where we get the immediate gratification of doing an ERCP or polypectomy or stopping a bleed. So you get that thrill of victory, but you also get the long-term relationships with IBD patients or a Barrett's patient where perhaps you've been following them for 20 years. And, you know, a lot of those patients become your friends.
I have exactly the same experience, right? So, you know, I don't dread clinic because, you know, for me, most of the patients I see are old friends, and we spend it, and it's a chat, it's a conversation as much as it is, you know, sort of. I suppose it is to some degree a therapeutic relationship, and maybe those aspects of being a physician ultimately are the most satisfying.
Larry, it's been a true pleasure. Thank you for joining us on Private Practice Perspectives.
Naresh, thank you so much for having me. It's a real privilege to be here.